This is Enid Hancock interviewing my husband, Dr. Mark Hancock, about the benefits of mistletoe therapy in cancer. Mark, could you tell us a little bit about why you would choose to use mistletoe for a patient?
Mistletoe, or Viscum album, it's one species of hundreds of types of mistletoe, has long been used in cancer therapy. It has multiple benefits, from quality of life, which has been shown both in systemic reviews and hundreds of clinical trials that have been done in Europe. And we have one ongoing trial being done right now in Johns Hopkins to case reports of tumor remissions, sometimes in very aggressive tumors like pancreatic cancer, and overall trends, and sometimes shown statistical benefits in overall survival with cancer. We have also reduced side effects from the other therapies that are done routinely, the chemotherapy, radiation, surgery that are done for cancer therapy. All of that's been shown in multiple studies overall. And why is it? I like to look at mistletoe as a plant first. I think if you look holistically at a plant, you can understand something of what it does, what the gesture it's saying. Mistletoe is sort of a rule breaker, a rebel of plants, a bohemian, doesn't like the rules, or may know they're there and doesn't follow them. Instead of growing straight up, it grows in a ball, not following light or gravity. It doesn't care about those things. It just grows in a ball. It also has its own rhythm of growth, growing very slowly, several years to get 2-3 feet in a size. And its flower takes 9 months to develop into a berry. Most plants do that over the seasons, from spring to summer or fall, maybe. But mistletoe flowers the end of winter and takes till the next winter to make its berry. So we see things in the winter where it's very strange making this flower and a berry, but it's one of the few things that do that then. And cancer is also, you can say, a distorted version of your own self. Something's happening to the interdependence of all of our cells that follow the community rules, that your own self gives an organization to your whole body structure and cells, and suddenly there's a tumor that's not following those rules. It's growing when it's not supposed to, it's going where it's not supposed to, and it's releasing inflammatory markers, etc., where it's not supposed to. And it's actually a chaotic mess if you look at it surgically. And so the mistletoe is relating itself to these chaotic forces, or these rebellious forces, showing us, hey, here's some. When we inject mistletoe subcutaneously, we have a red reaction. We have our body, that red reaction has been biopsied. It's swarming with our own immune system cells, our natural killer anti-cancer cells, and it's stimulating a counter force in our body, and that counter force that's stimulated is the healing force that is actually anti-cancer in us. So it starts making sense, this overall picture of why mistletoe for cancer. In high doses, mistletoe makes a fever, and we have seen in many, if you look for the data, it's there. Fever is actually very anti-cancer. People with cancer very often have a biography where they say in childhood or before, they're so healthy, they don't know how they would get this disease. They never get sick. They never get sick. They never get a fever. They never get the flu, or very rarely. And that's statistically true. In studies comparing healthy volunteers to ones with cancer, there are far fewer fevers in the ones with cancer. And sometimes we do use mistletoe to provoke fever in something we call MFIT, mistletoe fever induction therapy. That's not for everyone. Often mistletoe is just used subcutaneously to make these small red reactions, but when used aggressively in higher doses, we often use it like this. And the intermediate zone is often without fever, but much higher doses intravenously. Clinically, what we see in laboratory data is a decrease of inflammation overall. CRP trending downwards after using mistletoe. We see often less need to take medicines that will boost the immune system, or so-called boost the numbers at least, like Neupogen and Neulasta do. I've had patients that once they started mistletoe, even with chemotherapy, they didn't need those anymore because their numbers stayed consistent. That's not true of everyone, but it's been a consistent finding of mine clinically. Quality of life is good, and I've seen mistletoe as sort of a key to unlocking emotional doors that have to do with cancer. So mistletoe in general has a lot to do with helping people with cancer, and I'm very happy to be able to work clinically with many people that unfortunately have cancer, and I'm happy that I can bring this substance in the United States, where it's hard to find people that know mistletoe well, to them in a beneficial way. And I'm happy that I have the experience I have with it, working even up to intratumoral therapy. But I think that's the gist of what I would have to say.
Thank you so much. I really appreciate it, and hope that this is helpful to some people.